Our program, Alive and Thrive, FHI360 in Vietnam, is led by Nemat Hajipoy, and also working on it is our behavior change person, Nguyen Huang Zhang. And the two of them worked very hard on lots of formative research to figure out what is it that can help women understand that exclusive breastfeeding really means just that, breast milk only. The biggest threat to breastfeeding in Vietnam, as it turns out, was not necessarily promotion, and there is a lot of promotion of infant formula, but the biggest threat really was that mothers were giving water. They felt it was necessary. So really the idea for this came in promoting breast milk as a product and in narrowing it down to a single behavior in the case of this particular PSA, which was don't give water. So we've had some great advocacy wins in Vietnam, helping with UNICEF to lengthen the time of maternity leave so that mothers can breastfeed longer. And in addition to advocacy, we're doing a novel approach to face-to-face counseling done through the national health system, but in a franchise model, which is a little bit unusual for nutrition counseling. In addition to that, we've worked a lot with physicians and other healthcare workers, and of course, directly with parents and families. The mass media campaign is just one part of promoting better breastfeeding practices. We've been fortunate to have funding to do a rigorous evaluation. It's been more than 20 years since there's been a good, solid review of breastfeeding promotion through the mass media. And we did a baseline before the PSAs were on the air. At this point, about a year and a half into the campaign, we've had 2 rounds of research, and preliminary findings are showing that 80% of mothers that we questioned have seen the campaign. Of those 80% are able to recall an exact message from the campaign. And we're even seeing changes in behavior. Well, I think first, work with the professionals. It's not a simple matter of making an announcement on air, but of really crafting something that is emotional, that grips people, that improves people's self-efficacy or self-confidence that they can do the behavior, and helps to shift the social norm. So with all of those angles in place, we can see a big difference in behavior change.